My name's Sadie Jones and I'm a gynae cancer surgeon from the University Hospital of Wales in Cardiff. Prehabilitation is something that is becoming increasingly universal in care for patients with cancer going for surgery across the world. And certainly in the UK and specifically in Wales, there is no access for patients with ovarian cancer in terms of prehabilitation at all. So our project was to address this in Wales. We developed a personalised and multimodal prehabilitation service that really aimed to improve their nutritional status, their physical status and their emotional well-being in preparation for their ovarian cancer surgery. And we did this through a comprehensive baseline assessment, which meant that for each patient they got a prescription of those interventions that suited their particular needs. And then a programme was specifically developed for that patient that followed them over the course of their treatment right through to the completion of their treatment. And we did this for 1 year for all patients coming through the 3 cancer centres in Wales. The early data certainly indicates that from a patient's perspective, patients have really enjoyed having this service available to them for a multitude of reasons. First of all, I think that they've fed back to us that feeling that we're looking after them in a more holistic way, addressing needs that were previously unmet, having that time to talk to people with different skill set like dietitians and occupational therapists to address those needs, for example, fatigue management, stress management. What this programme has certainly enabled is much better understanding from a surgeon's perspective, really what can an occupational therapist offer for the patients that I'm looking after, similarly for the dietitian, and actually it turns out that we can all work together so as we're all bringing our best for the patients from the different angles that we're looking at. And then there's some actual meaningful data as well. What we were hoping to do was reduce the time a patient spends in hospital after their operation, so basically make them able to recover faster from their surgery. And we've certainly demonstrated that patients were staying in hospital for nearly 8 days on average prior to prehabilitation, and with prehabilitation we've dropped that down to about 5.5 days, and that's really important for patients. And we seem to be getting them back to their chemotherapy faster after their surgery as well. So if we can speed that up, then all the better, and hopefully it will improve their prognosis further down the line. The key headlines are that prehabilitation for ovarian cancer patients seems to make a difference. We're seeing reduced length of stay in hospital and hopefully speedier returns to chemotherapy after treatment. That it is deliverable with motivated teams, so it's something that we can achieve, but that crucially we need to understand how we can deliver this resource effectively within the NHS setting.